Okay, right now I want to talk about physical examination. And for an asthmatic patient, if has come up with difficulty in breathing with, a doctor will want to determine if it's asthma or any other related condition like pneumonia or TB. So in this case, the doctor might want to do a number of things on you so that to be able to ascertain if it's asthma. And the first thing he or she will want to do, he will want to do a chest exam. A chest exam will want to examine the chest to examine if you're breathing well, and he will have to put stethoscope, this machine or this machine on your chest to be able to listen to your chest to ascertain if there's a wheeze. As we have said earlier, that a wheeze is one of the signs. So he'll want to put it to ascertain if there's crepitations or a wheeze, and if there's a wheeze, it suggests that there's a either pneumonia or asthma. And then another thing the doctor will want to do, he or she will want to look into your nose, into your throat, into upper airways to be able to ascertain if there is nasal polyps or there is nasal congestion. And in this particular thing, he'll be able to ascertain or to rule out if there is sinuses or rhinitis. So another thing on the same, he'll go further to request for some test, and the test is to do a spirometry. This is to ascertain the function of your lungs, to be able to know that if their lungs are functioning well. Another thing, he might order a blood test, that is the full hemogram, and at the full hemogram, he will run that test and to ascertain if there's a elevated eosinophils. If there's an elevated eosinophils, it means that there's okay. Just to elaborate, only medical people will understand what I'm talking about. Eosinophil is a component in the white blood cells that will rise up or will be elevated in times if a person comes into contact with an allergen. So in this case, in asthmatic cases, you will find it goes up. Another thing, maybe if there's an insect bite, also the eosinophils will rise up. So another thing the doctor might request from you is a chest X-ray, and this will help to rule out if it's asthma. And if it's in asthma condition, the chest X-ray might appear to be normal, or it might appear to be hyperinflation. It means that it contains a lot of air, and then. In other term, this chest X-ray will also help us to rule out if it is pneumonia or TB. So those are the few things that the doctor might request from you. And another thing is something that you might be requested also is arterial blood gas. This is help to ascertain the level of oxygen in your system. So in asthmatic cases, we find that there's airway obstruction, and if there's airway obstruction, it means that the oxygen getting into your system is limited. So there might be an they might be deficiency in oxygen. So which might lead to alkalosis or acidosis. Another quick thing that the doctor might do is a pulse oximetry, whereby he will pick one of your fingers and place a pulse oximeter, which will measure the level of oxygen in your system, and that is it's done instant. So with this, the doctor will be able to ascertain if it is asthma.